Bianca Castanola, and I'm going to be discussing the risk factors for adolescents developing antisocial personality disorder. So in this presentation, I'm going to be discussing exactly what antisocial personality disorder is, why this topic is important, and then I'll be going over the research articles that I found on ASPD and the risk factors for adolescents. The DSM-4 defines antisocial personality disorder as the pervasive pattern of disregard for others occurring since age 15 as indicated by at least 3 of the following: failure to conform to social norms that are ground for arrest, deceitfulness, lack of remorse, and also lack of stability, recklessness, aggressiveness. There is about 7 things total, and people have to fall under at least 3. The individual must also be at least 18 years of age. There must be evidence of conduct disorder before 15 years of age, and their symptoms cannot be explained by schizophrenia or a manic episode. It is also important to note that the DSM doesn't recognize the term psychopath or sociopath anymore. Antisocial personality disorder, which I will refer to as ASPD from now on, ASPD is the umbrella term for both psychopath and sociopath. This topic is important because the onset of ASPD is typically in adolescence to early adulthood. This is also a very serious diagnosis. Even though there is no cure currently, treatment may help the severity of it. Adolescence is a period of physical, mental, and emotional growth, because this is when people develop the ability to control their own behavior, and they typically engage in more risk-taking behavior or experimentation. Morgado and Diaz wrote an article synthesizing conclusions from previous research on this topic. One area they identified were socioeconomic risk factors for adolescents developing ASPD. Adolescents in low socioeconomic conditions are at a higher risk for developing ASPD. These effects may not be immediate, but also indirect, being mediated by other conditions like family factors. This is due to the decrease in chances of the adolescent learning pro-social alternatives to deviancy. Renda and her colleagues researched the association between bullying and subsequent ASPD. They conducted a longitudinal study collecting 15 waves of data via questionnaires. As a result, they found a statistically significant difference was found between adolescent bullying and antisocial behavior. In simple terms, adolescent bullying engagement is a strong predictor of developing antisocial personality disorder, and this relationship is found to be stronger for males. Ferguson and his colleagues examined the links between exposure to childhood sexual and childhood physical abuse and the development of ASPD. They conducted a longitudinal study, approximately 25 years, collecting a wide range of data on the health, development, and adjustment of the participants. The results suggest that the long-term exposure to childhood abuse is a risk factor for developing long-term disorders like ASPD. It was also discovered that sexual abuse has a stronger and more consistent effect than physical abuse does. Lumens and colleagues studied the association between altered levels of hormones, such as cortisol and testosterone, with ASPD. 166 men were studied, 81 of which had ASPD, and 42 of which were at the time diagnosed with psychopathy, when the DSM still considered that as a term. Saliva samples were taken from all participants. It was found that patients and hospital employees had higher testosterone levels than the general population. With that being said, those with altered hormone levels are at risk for developing ASPD. Dixon and colleagues researched ASPD risk factors for individuals with and without intellectual disability. Previous research has suggested a higher risk of ASPD among individuals with intellectual disability. Self-reported data was collected from 4,174 adolescents, 98 of which had intellectual disability. As a result, previous research results were confirmed. Those with intellectual disability are more likely to experience risk factors, such as low socioeconomic status, known to be associated with antisocial personality disorder. So that's not due to the disability itself, but the factors that typically come with it, like I said, socioeconomic status. In conclusion, antisocial personality disorder is a serious mental health disorder characterized by the disregard for others and social norms. Due to the onset of ASPD occurring during adolescence, there are many risk factors during this time, such as family life, socioeconomic status, bullying, and many more. This is an important subject matter for many reasons, because there is no cure for ASPD as of yet, but preventative measures can lessen the severity of the disorder over time. This developmental stage is important because of the amount of mental development occurring during adolescence. Adolescents can also be very impressionable.